Hello, this is Jay Vaughn with Hindy Johnson Vaughn Emery. Um, we have offices in Louisville, Kentucky and Fort Mitchell, Kentucky, right near Cincinnati, Ohio. I'm a plaintiff's trial lawyer, been practicing approximately 20 years. I handle mainly truck crash cases and traumatic brain injury cases. I've been doing a series of videos on traumatic brain injury, and this is the third video for you. Hopefully you found the first two helpful and informative. If you haven't seen them, I encourage you to go back and watch them. This video, I just want to really focus on the different medical specialties for traumatic brain injury patients. Brain injuries affect everyone in a different way. They involve physical, mental, emotional, personality, and sleep changes. So there's different medical specialties that you need to be aware of. Usually the initial person your client will see is an emergency room physician. And many times they will diagnose a brain injury, but there's a pretty high statistic of emergency room physicians that don't diagnose a brain injury. It's not because they aren't smart enough or competent enough to diagnose it. It's that usually isn't their focus. Their focus is, hey, is this person going to die? Are there any life altering or affecting conditions that I need to deal with? And if the person's going to be okay and I don't need to do any emergency surgery, call in a neurosurgeon or something like that, I need to move on to the next patient who may come in with a gunshot wound or had a heart attack or whatever it may be. So it's common that TBI is not diagnosed initially in the emergency room. Your client will maybe then follow up with their primary care physician, and sometimes a family doctor really does pick up on brain injury, especially if they've had that patient for a long time. They may pick up on some differences, some of the signs or symptoms that I covered in the second video. Then you go down through a list of more of the common providers that your client will see in the long term. It can be a neurologist. There are several good neurologists out there who understand traumatic brain injury, but there's a lot of neurologists that don't. They have studied brain injury some, they have treated it some, but they really don't specialize in it or keep up with the current literature and the current technology, which leads me to really the category of doctor that I prefer my clients to see who have brain injuries or may have a brain injury, and that's a physiatrist, also known as a physical medicine and rehabilitation doctor. Most physiatrists spend a great deal of their training to become a physician studying brain injury, and most of their practice, or a good portion of their practice, deals with traumatic brain injury. So that's the profession or the specialty I typically prefer my clients to see if I think they have a TBI. There's also, they can be seen by a psychologist or a neuropsychologist, go through psychological testing, a psychiatrist or a neuropsychiatrist, especially if you suspect they may have post-traumatic stress disorder due to the event, due to the brain injury. A lot of the signs and symptoms of brain injury and PTSD overlap, and PTSD really can be a subset of traumatic brain injury. A lot of times you'll want imaging done by a radiologist or a neuroradiologist, whether it be MRI with a 3T or a 3 Tesla machine, with what's known as FLAIR, what's known as SWI, what's known as DTI, diffuse tensor imaging. Maybe you want something like volumetric analysis done, like NeuroQuant. So you need to go to a really good, find someone who understands and has the equipment to run this type of imaging, because it can be very helpful to your case. Also, if your client's having some vision issues, an optometrist or neuro-optometrist can be very important. There are certain tests that they can give your client, and which are objective, verifiable tests that can document trauma to the brain affecting the eye. Another area that's really developing a lot is endocrinology. An endocrinologist or a neuroendocrinologist. A lot of clients will sustain an injury to their pituitary gland, which is a small area tucked back in the brain, in the bottom of the brain, which controls the hormones. And you can have clients that have a growth hormone deficiency due to trauma from the brain injury, which is permanent. It may require them to take human growth hormone or HGH injections for the rest of their life. And that can only be diagnosed by an endocrinologist doing a specific test. So those are things to consider, because it definitely, if you have a decrease in hormones, it can affect your quality of life. They may need to see an ear, nose, and throat specialist or an otolaryngologist. Had a client once that had an ear fistula, had a hole in his ear until he got to see an ENT. It was from a crash, has dizziness, balance issues, things of that nature. So you have to once he got to the right specialist and he got diagnosed with the vestibular concussion and the ear fistula, was able to have a surgery, which corrected a lot of his problems and improved his quality of life. Again, if your client's having sleep problems, maybe some type of sleep specialist, and then for therapy, sometimes a physical therapist, occupational therapist, speech language pathologist or therapist, balance therapist, someone for vestibular rehabilitation. Cognitive behavioral therapy is really important, especially early on, if your client can get into the right people early on, and the vision therapist. So those are the main providers that I've had clients see over the years. It just depends. Again, every case is different. Every client is different. But the importance is you have the knowledge of the type of symptoms they have, the type of providers they may need to see, and it may require a phone call or a meeting with some of their current treating doctors to figure out what the best course of action is. So hopefully this has been helpful to you. Again, my name is Jay Vaughn. I'm a partner of the law firm Hendy Johnson Vaughn Emery, and I hope you learn something from this that can benefit your clients in the future. Thank you very much.